As more and more Americans use blockbuster diabetes and obesity medications like Ozempic and Wegovy for weight loss and to treat other health conditions, some insurers are saying it's too expensive for them. They are dropping the medication for those users. Starting in January, Blue Cross Blue Shield of Michigan, for example, will not be covering Ozempic and Wegovy costs anymore for people who use the drugs to lose weight. The company is emphasizing that patients who take these drugs for diabetes or heart disease risk factors won't be affected here. Beginning in August, patients will have to visit a doctor in person and have a BMI, a body mass index, of 35 or higher to qualify for insurance coverage. No children will be covered. And this means around 10,000 people in that state will lose their coverage. Michigan, far from the only state where this is happening. Joining us to talk more about this is Dr. David Montgomery, NewsNation medical contributor. It is good to see you, Dr. Montgomery. Thanks for making the time.
Great to be with you, Natasha.
Let's talk more about this. This is a big deal. I mean, this is the difference between maybe a $25, $50 copay a month for a lot of these patients versus more than $1,000 a month in some cases.
Yeah, I mean, the big issue here is whether or not this catches on in other states. I believe that this is short-sighted for a number of reasons. The first one is really this. It's very clear that obesity is a disease, and this has been proclaimed by the AMA, the WHO, as a disease. We know that there is no other disease that's being treated like this. Hey, listen, we'll pay for other diseases like heart disease and diabetes, but we won't pay for this disease. This is called the obesity bias. We still have that. The second one is, I think it's economically short-sighted. It's really clear that obesity costs us hundreds of billions of dollars. Actually, the Stop Obesity Alliance quoted $1.4 trillion in direct and indirect costs in 2014. That was 10 years ago. So I think that them making that decision on some short-term sort of goals, financial goals, quarterly goals, whatever it is really short-sighted in that we pay much, much more than that. This is a drug that helps people reverse obesity and reverse the diseases that come along with it. So I think this is short-sighted.
Yeah, in addition to Blue Cross Blue Shield of Michigan, we're seeing insurers right now in Connecticut, North Carolina, Texas, and Washington also dropping coverage. I mean, this is really starting to happen like a domino effect. It sounds like you do not think that this is a decision that's being made with the patient's best interest in mind long-term.
Well, yeah, I mean, absolutely. And that's first what the doctors are, tasked with doing. First do no harm and then do the very best you can to get effective care. These drugs are a breakthrough. They're a veritable breakthrough in our time, in real time. And they are reversing in real time obesity and the conditions that come along with it. I also think that it is a poor economic decision. I don't run those corporations, but I'm telling you, they're not thinking about the millions and millions of dollars per day that are going into ER visits and doctor's visits and CT scans and all sorts of things that come from diabetes, hypertension, and low back pain, the top three things that come from obesity in terms of the bottom line. So I think that once they start really thinking about this, and we probably are going to have to get Congress involved in this, but once they start really thinking about this, this will be reversed, I'm almost certain.
Yeah, this is really interesting as well, because we are seeing early data that these drugs are so impactful and effective outside of even diabetes and weight loss. I know, we've discussed heart issues here on the show, helpful with kidney disease. I think there's some new data that just came out that it can reverse fatty liver disease. There are millions of Americans who are struggling with non-alcoholic fatty liver disease as well. Even psoriasis are early indicators showing that as well. Do you think that over time, insurance companies, as this gets approved for more and more and more health issues and conditions, that they will just be forced to cover this for more and more people?
I think we're going to have to zoom out on this. I think it's going to have to be a global solution. I think the cost of the raw materials that go into making this for the two brand name, the companies that make the two brand names, Novo Nordisk and Eli Lilly, I think that's going to have to happen really quickly. It's probably going to have an intervention by Congress or the government in some way, shape, or form. The list goes on. It's Alzheimer's, it's PCOS. There's so many different things that the drug helps, but that's not the issue. The issue is obesity, a real bona fide disease that costs a lot of money and a lot of people's lives. Not just money, but people's lives and families who are going to lose their loved ones from a disease that now we know can be reversed by this drug therapy. I think we should rethink this.
Okay. Dr. David Montgomery, really appreciate your insight on this tonight. Thank you so much. Thank you for watching. Go to newsnationnow.com to find News Nation on your television provider. And don't forget to click the red subscribe button below to get more of News Nation's fact-driven, unbiased coverage.